Now first let us go through auto antibodies that are used in connective tissue disease. So what you will do, ANA, ANA, अंदर घुसना, that is the entry criteria. Now anti-C1q correlates with disease activity. How you will can remember? You can remember C1. When there is flares of this disease, then there is C1 that is getting elevated. Now also now we move towards the next antibody, that is antihistone. Now antihistone is associated with drug induced lupus. Now stone, drug are derived from this stone, you can remember that. Now anti-SM, now anti-SM is the most specific. SM most specific, just read it in reverse order. Now anti-neuronal anti-glutamate receptor 2, it is related with CNS lupus. Anti-neuronal antibody anti-glutamate 2 receptor is associated with CNS lupus. See, it can be easily learned because it is a neuronal or glutamate, definitely it is related with CNS lupus. But don't confuse it with psychiatric one, in which it is anti-ribosomal P for psychiatric. Now next is anti-U1 RNP. See, when we give these abusing word, when we use abusing word, when we are in youth, Yovan, or you can also remember that pop singer MC and like that. Now we come towards the Rola. See, for Rola, you can remember that it is related with Sjogren syndrome. And what is it? Is a congenital heart block, and it causes heart block and causes neonatal lupus. See, when you Sjogren, you also remember that most common manifestation is eye in keratoconjunctivitis sicca happens. So it is Rola, rone ke liye. So both things are interrelated. Now Jovan is the Jonas Brothers, if you remember, Jonas Brothers, they use synthesizer. So anti-synthetase. Anti-Mi2 is dermatomyositis and is associated with good prognosis. This can be remembered by C. If you have seen Mission Impossible, and they are very they look over, take care of their bodies and look goody and all, something like that. Dermatomyositis, they are very much particular about how they look. So Mission Impossible, dermatomyositis. Now for anti-topoisomerase 1 and anti-SCL70, that you have to remember scleroderma. See, anti-topoisomerase 1, it is a lengthy name. Topoisomerase 1 or anti-SCL70, it is associated with scleroderma. And then anti-centromere crest. See, when in centromere, there is, if you take a lateral picture, see, suppose this is a chromosome and with the centromere in between. Now I would see from this direction horizontally, so it would be something like this. So there is a crest. Now this is centromere. Now centromere, here crest is elevating, so crest, anti-centromere crest antibody is seen. Now also remember that with polymyositis and dermatomyositis, you can remember it by Jo1 anti-Mi2. Now we move towards the autoantibodies fluorescence pattern. See, histone have H, so it is histone have H, so it is homogeneous. Anti-DS DNA will have antihistone. Now in Rola will have speckled pattern. See what happens, that you cry in your youth. Just remember that. So how will you remember that? See, anti-Rola or Jo1. Jo1 was associated with anti-synthetase. How you have to remember that Jonas Brothers are using synthesizer for creating music. Okay? Now Rola, Zo1 or anti-U1 RNP, it is, they have a speckled pattern. U1, Jo1 and Rola, they have speckled pattern. Now anti-smooth muscle will have a smooth muscle pattern. that is there would be continuous boundary. And then we have antitopoisomerase sclerose 70. This is occurring in crest syndrome, in which it appears. Now remember that crest was against centromere, and centromere is at the center, so it would show a bi-centric kind of thing, that these two things are joined to each other, and then there will be a fluorescent pattern. Now we can move on to the other autoantibodies. Anti-TPO for thyroiditis, long acting TSH receptor, Graves' disease. Now, anti-LKM1 is autoimmune hepatitis. It is associated with ampulosis and interface hepatitis. Remember, anti-SM or anti-LKM1, it is associated with autoimmune hepatitis. Now, it causes amperopolesis or interface hepatitis. So you can remember that vowels will stick together: A, E, I. Now also we move on to the next antibody, that is AMA antibody, antimitochondrial. Now antimitochondrial is seen in PBC. I have a separate video and it is already on YouTube, so you can see that. So primary biliary cirrhosis was present as pruritus, xanthelisma, osteopenia, florid bile duct lesion versus primary sclerosing cholangitis. Now P. ANCA. Now P. ANCA is microscopic polyangiitis, CSS, ulcerative colitis. C. ANCA is VWG. Now C will be SW. So C. ANCA is present in venous granulomatosis. Now in ASCA. ASCA is in Crohn's disease. And rheumatoid factor, it's seen IgM is raised, FCIgG. We can remember it by MRF. That is IgM seen in rheumatic fever with FC portion. Now move on to the other things. Now we move on to the sarcoidosis. Sarcoidosis, remember 1, 2, 3 sign or Garland sign. Now in this we have bilateral hilar and paratracheal lymph nodes. And now we have erythema nodosum. Erythema nodosum is the most common manifestation in sarcoidosis. See, remember, rosacea would involve the nasolabial fold. Rosacea is like a rose, so everything is rosy, so nasolabial fold is involved, but in SLE nasolabial fold is not involved. So also you can remember that this is sarcoidosis. So here Schaumann or asteroid bodies would be seen. So the thing that you will have to remember is that what is Lofgren syndrome. Lofgren is L and this N. So there would be hilar lymphadenopathy plus erythema nodosum. Now after that Herefordite, you remember that there will be Fordite will be fever plus Here. Now everybody wants a good looking Here. Every Raja wants a good looking Here. So good looking Here represents to facial nerve, that is 7th cranial nerve. And remember, see, in sarcoidosis, what is happening is that CD4, normally CD4 is to CD8 is 2 is to 1. But in bronchoalveolar lavage in sarcoidosis, it would become 5 is to 1. And other things that is associated with it, you can also remember it in an ABCD form. See, ACE is increased, bronchoalveolar lavage shows 5 is to 1. C is calcium is increased. Now it is the ABC of sarcoidosis. And remember separately that there is a QIM test that is also done here. What is QIM test if somebody asks? Skin test. It is a skin test that is used to detect sarcoidosis. Now we move on to the scleroderma crest. Now there are some seen in diffuse, some seen in limited type. It is important, but remember there's no such trick for this. Just remember that whatever ma'am has taught, just go through those things. Delete the last part. Now we come towards the Sjogren syndrome. Now in Sjogren syndrome, what you will do is that you will get the glandular manifestation and extraglandular manifestation. The main basic thing is that you get dry eyes, and that can be traced by Schimmer's test or Rose Bengal stain. Again, here is there is not much mnemonic. It will be only available for your extraglandular manifestation. What are the extraglandular and glandular manifestation of Sjogren syndrome? So they are jog plus R plus 1 is equal to, see, jogging is related to arthritis, R is related to Raynaud's phenomena, and 1 is associated with tubular acidosis 1. And for lymphoma, you have CHOP plus rituximab. Now we come on, now there is a table, difference table here given. Just go through. There's a table for HIV infection and Sjogren syndrome and sarcoidosis. So how we will remember? In this there is lack of antibodies, in this there is presence of auto antibodies, and there is again lack of antibodies. Now you remember that in HIV CD8 plus cell infiltrate, here CD4 plus infiltrate, here we have granulomas. So how will you remember that? There is CD4 plus T lymphocytes in Sjogren. Now HIV infection is normally seen with HLA-DR5, and Sjogren is associated with HLA-DR3 and DRW52. How you can remember? See, HLA-DR3, CD4 and HLA-DR52. So it all in it is order 3, 4, and then the two extremes, that is 52, 2 and 5. Now just remember a certain fact that see, IgG4 is not such important, but okay, if you want to go through, you can go through that. Dramatic response to steroids is seen. Tumor starts melting after second dose of steroids. Now in this, what we get autoimmune pancreatitis, in which there is sausage shaped pancreas, and this is the only reversible cause of pancreatitis. Now lymphoplasmocytic infiltration, storiform fibrosis and obliterative phlebitis is seen in this form of autoimmune pancreatitis. Lymphoplasmocytic infiltration, storiform fibrosis, obliterative phlebitis. Mayo's clinic criteria, HISOD. Now in Mayo's clinic criteria, histology, imaging, serology, other organs, and response to steroids is seen. Now we come on to the one of the most important table, that is approach to myopathies. How you will deal with approach to myopathy. So just remember that in polymyalgia rheumatica, it is the condition is itself saying that there is pain in number of muscles and joints because rheumatica is there. So what would be ESR, polymyalgia rheumatica? In this, what will happen? See, ESR would increase, but creatinine kinase would remain normal. And also remember that polymyalgia rheumatica generally will occur in older individuals, that is more than 50 years. So morning stiffness, raised ESR, CRP, shoulder tip pain, and etc. etc. Now what happens in inflammatory myopathy? Now inflammatory myopathy, as there is inflammation, so ESR would be definitely be raised. Now for creatine kinase, inflammation will destruct the muscles also, so creatine kinase would also be raised. And then there is myopathy, so proximal pain and weakness will always be there. See, inflammatory is like हर जगह आग लगी है, आग लग गई, आग लग गई, आग लग गई, ठीक है. Now inflammatory is हर जगह आग लग गई है, अनु मलिक का आग लग गई, आग लग गई. So in that, ESR is raised and creatine kinase is raised. Now we move on to steroid myopathy. So in steroid myopathy, see, steroids is itself given to lower the immune response. So definitely ESR would decrease, creatine kinase would decrease, and there would nothing be significant here. Now we come on to the statin myopathy. Now statin myopathy, just remember that stat and in. See, kinase is increased and there is pain. Kinase is, that is creatine kinase is increased and there is pain, and rest all other are normal. What happens in hypothyroidism? Again hypothyroidism, creatine kinase is raised but ESR is normal because it is not some kind of inflammation happening, proximal pain and weakness, and bus delayed tendon reflexes. One thing you can also remember is that dermatomyositis, there would be perimysial CD4 cellular infiltrates. Otherwise in polymyositis and inclusion body, there is endomysial. Just remember that this was a question asked in NEET. So dermatomyositis and polymyositis and inclusion body myositis. So dermatomyositis shows perimysial CD4. Just remember that. See, it is the only condition which have derma written in it. So derma, and what is the work of derma? To cover the body. So covering of the body is formed. So CD4, perimysial CD4 is seen. Since perimysial CD4 is seen, so there would be thick skin, that is scleroderma, and MCT tissue only involved. Now rest is polymyositis. In that endomysial CD8 plus is involved again, and in inclusion body also CD8 plus involved. See, I had said earlier that in dermatomyositis, covering, it is a covering, so everything is perimysial. Now perivascular inflammation, perivascular atrophy, so everything here in dermatomyositis is having PPP: perimysial, perivascular, perivascular. Now we want to polymyositis. Now in polymyositis, there will be nothing peri, and it will have endomysial, CD8 plus endomysial. And anti-synthetase syndrome will have CD4 anti-synthetase syndrome. It will have again perimysial, perivascular inflammation, but CD4 plus cells. Now we move on to IBM, inclusion body myositis. It is proximal and distal have the same occurrence, and it have endomysial, perivascular inflammation plus rimmed vacuoles in inclusion body. See, there is a inclusion, some bigger inclusion is being formed, so the whole cell is pushed aside, so there are rimmed vacuoles. A vacuole is lying in the center, and CD8 nucleus is lying in the periphery in the inclusion body, as the name implies. Now we move on to the inflammatory myopathies. Now inflammatory myopathies, just remember that we have fair anti-synthetase syndrome. Now inflammatory myopathies, you have anti-synthetase syndrome. Jovan, you can remember it by the mnemonic fair fever, arthritis, interstitial lung disease, Raynaud, proximal muscle weakness, and anti-amino acid tRNA synthetase enzyme. Now we move on to arthritis. Now in arthritis, we have to remember that what would be occurring here. So and I will be telling you again the important stuff that can be learned by the mnemonic. So in gout, rat bite erosion is seen, Martel G sign. Now in chondrocalcinosis, we see pseudo gout. Now when we pass it through birefringence, so rhomboid needle type rhomboid is seen in MSU, whereas in PPD we see rhomboid. Pseudo gout, what is pseudo gout? Pseudo gout is CPPD, calcium pyrophosphate crystal deposition in the elderly, and it is mostly happening where? In the knee joint. Whereas gout would be seen in the first toe. Now that is see, you would learn regarding the DMRD, but what I want to tell you is that allopurinol is only used in chronic gout here, and it is not used in acute gout. Now we come on to the abacavir. Now abacavir, we have 57 and allopurinol 58 mutation. Now let us start with sarcoidosis. Now first remember that sarc, it would be right paratracheal lymph node that is getting enlarged, along with bilateral hilar lymph nodes showing garland sign. Now remember that since it is a sarcoidosis, we will take the arc here. So in the face there is arc, in the face here there is arc, and in between here there is nose. That is, it has lupus like lesion, lupus pernio, because there is sparing of the nasal fold. See, in like lupus pernio will have malar rashes, but there would be sparing of nasolabial fold. Now we move on to the other part. Now just remember the starting two letters. That would be now become Schaumann bodies, asteroid bodies. Now, more about sarcoidosis. We get panda sign on gallium scan. Just remember that gallium scan happens. And next, Lofgren syndrome. Now, Lofgren, you can remember it by hilar lymph node enlargement plus erythema nodosum. Now we move next to the Herefordshire syndrome. Now हीर जैसा चेहरा, that is seventh cranial nerve. So here would be there for fever plus seventh cranial nerve palsy, and it will not show other signs. Now what are the lab features? Laboratory features would be, see, sarcoidosis. You have to remember that there is normally normally CD4 is to CD8 is 2 is to 1, but in sarcoidosis this would be 5 is to 1. How to remember that? You can convert sarcoidosis as to 5. Now remember that why while the CD4 count is increasing here, but it is increasing it at a cost. It is increasing at the cost of lymphocytes. Therefore, we see lymphopenia. Now remember that sarcoidosis, we have increase in ACE, so ACE, and also increase in calcium. So what is the ultimate purpose? Its ultimate purpose is to increase the blood pressure. See, increasing ACE, increase calcium, it will increase the blood pressure to a smaller extent, but that part you can eliminate just to understand that whole pattern of the disease. Now we do QIM test and all, and just remember that in bronchoalveolar lavage you will increase the CD4 is to CD8 CD8 is to CD4 ratio would be increased. Now in autoantibodies, we have to remember some simple things, that how this will appear on fluorescence pattern. Now, often this is asked and people find it really difficult to remember, but I will try to make it simpler for you. See, first is homogeneous pattern. Now in homogeneous pattern, H, now we will have H and H, histone, and histone is covered around DNA. So this will show homogeneous pattern. Second, we have now speckled. Just misread speckled as spectacle. Of whom? Of Joey. So from Joey you will get Jovan, and he is crying. So Rola, and he is in his Yovan. That is in it, he is in his youth stage. So speckled pattern is seen in Jovan, and Rola. Third, we have anti-smooth muscle. See, smoothness is from the outside. For example, we try to make our house smooth from outside so that it looks good from outside. We do plastering, we do paintings and all in Diwali and all. So we try to look good from outside. So there should be smoothness in the wall. So in anti-SM is outside. So in this you have periphery pattern. And the rest remaining is, that crest syndrome, NTSCL70 and all, anti-topo, these will form nucleolar pattern. These will form nucleolar pattern because they are directly going and attaching in where? They are attaching directly to histones and all. So remember that here we will have nucleolar pattern. Just pause it and look it for a moment and you will remember it for life. One more antibodies that is remaining is ASCA antibodies. You remember that ASCA. Now ASCA is seen in Crohn's disease. Now many of the diseases here are taught regarding are related to hypersensitivity. So we have type 3 hypersensitivity mnemonics. So how you can remember? Sharp. In this you will have serum sickness and SLE, hypersensitivity, pneumonitis, and hinoxolin purpura, Arthus reaction, reactive arthritis, rheumatoid arthritis, and we have PSGN and PAN. But remember, although SLE is a part, just point to be noted that SLE is a part of type 3 hypersensitivity. But when we go for lupus nephritis, it is type 4 hypersensitivity. And also remember that it has full house pattern. In full house pattern, you have GAM increasing. Now remember the Raynaud's phenomena. Now Raynaud's phenomena, it can be remembered by Weber. That is white, blue, red because of vasoconstriction, cyanosis, volume flowing. Now we move on to the next disease, that is Sjogren. In Sjogren, you will remember that we carry out Schimmer's test or Rose Bengal stain, but that is not my point of discussion right now because it's information. But I will teach you only those topics in which I have a certain mnemonics and all. Remember, in Sjogren syndrome, now you have Sjogren. Now you have Jog R N. That is, while jogging, what will happen? Jogging arthritis can happen, or Raynaud's phenomena can happen, and and one. In one, we will have renal tubular acidosis type 1. So now we will go for bilateral, and now we go for differential diagnosis of Sjogren syndrome. So what Sjogren syndrome often presents with bilateral parotid enlargement, and we have different DDs are HIV infection, Sjogren syndrome, and sarcoidosis. So remember that in Sjogren, something that is janin jagran, 52 हफ्तों का part. If you have remembered that, this is something that is done. So if you remember this much, I guarantee you that you will remember Sjogren syndrome. So जागरण में कौन होते हैं? समाज के वो 4 लोग, that is CD4 plus cells, and they are associated with HLA, DR3 and DRW52. How to remember that? See, you have समाज के वो 4 लोग 3 डायरेक्शन से आ रहे हैं और ये 52 हफ्तों का जागरण है. By that you can remember, you can learn the Sjogren syndrome. Now we move on to the approach to myopathy. How we will do myopathy? Now we have certain DDs, that is polymyalgia rheumatica, inflammatory myopathies,